Hi everyone, today we will be studying about the acetylcholine. Acetylcholine is the key neurotransmitter in our body. This is majorly work as a rest and the digest hormone. Effects of low acetylcholine will be discussed throughout this video. These changes in the acetylcholine levels generally happens due to age or due to certain drugs. We would be discussing about the symptoms presentation of the low acetylcholine. Also, we'll be exploring the complex interplay between the homeopathic remedies, neurochemical pathways, and the relevant symptoms from the homeopathic textbooks. Now, we would be introducing you about the acetylcholine. This is the major neurotransmitter which is released at the synaptic levels. So there are three main areas where the acetylcholine function is most appropriately worked. One is the prefrontal One is the frontal cortex, where primarily it affects the cognition of the person. So whenever there is some damage to the acetylcholine levels, it leads to Alzheimer's, where the cognition gets low. So majorly acetylcholine works to improve the cognition of the person, the arousal, the attention span of the person, the learning capacities, and the behavioral inhibitions are increased when acetylcholine is low. Second area where the acetylcholine influences is the peripheral parasympathetic system. Here it majorly works on the motor functions of the gut, motor functions of the vascular walls, the tone of the muscles, and the spasmodic action. It affects the sweat glands, and finally it affects the sensory organs where the acuteness of those organs increases. Third area where it works is autonomic nervous system. Here it affects the heart rate, the size of the pupil, the salivary glands, and the imagination. Imagination works in a way a patient becomes hallucinating. An example of imagination getting affected by acetylcholine. Now, many effects are also there due to the neurotransmitter interplay. The relationship reveals how relative dopamine changes cause emotional feeling of overwhelm. For a small impulse or stimuli, the person starts to overwhelm, react aggressively, emotionally. The rationalization reduces. Then again, the changes in the GABA tone creates a cascade of epileptic spasm and increased muscle tone. Acetylcholine gives cholinergic protection also to the amygdala, thus mitigates and rationalizes fear. Acetylcholine underproduction and early removal from the synapses. Either the acetylcholine production is reduced or it is removed very fast from the synaptic junction. The enzyme responsible for the early removal of the synapse from the synapses is cholinesterase. Most of the antidepressants use cholinesterase inhibitors to improve the acetylcholine availability. Now, low acetylcholine is presented in the form of delirium. So, high cholinesterase activity during fever causes delirious state. Poor behavioral grading leads to fear and agitation. Second, commonly presented low acetylcholine is in the form of Alzheimer's disease, where there is a poor ability to learn and pay attention and affects the brain function and focus. Third area where anticholinergic activity is seen is through drugs like antihistamines. They cause dryness of mouth, which is often a sign of low acetylcholine. Now, what are the symptoms of low acetylcholine? How it is available or presented in Clinical settings. Whenever the acetylcholine goes low in the frontal cortex, the patient presents with irritability, restlessness, attention instability, emotional overwhelm, poor judgment, learning disability, and delirium. In the parasympathetic system, it presents as a dryness of mouth, retching without salivation, constipation, poor sweating, sensory flooding, affected easily by sound, light, touch, and noise. In the autonomic nervous system, acetylcholine, low acetylcholine is presented with bradycardia, pupil dilation, causing diplopia and blurred vision, irritability, motor restlessness, through relative increase in dopamine, though through a relative increase in dopamine cause emotional overwhelm state with emotional overdrive. Through reduced GABA inhibitory activity cause spasms and epilepsy, followed by nausea. Fidgeting is seen, then patient can't sit still and they're easily distracted. There is an aimless pacing and also a kind of hostility is seen. So many physiological effects due to low nitric oxide production are also due to the low acetylcholine. There are atherosclerotic changes, inflammatory endothelial damage, stiff arterial wall, congested fundus of eye with throbbing pain, even to the extent of glaucoma. There is an inadequate vasodilation. Increased systemic resistance is caused due to inadequate vasodilation, and nitric oxide is used as a vasodilator, and it is an antioxidant which prevents inflammatory actions at the endothelial level. Increased blood pressure is commonly seen with inadequate vasodilation. Poor tissue perfusion, so you'll find cold extremities and also neuropathies. So now, whenever the acetylcholine is low, there is a transient and adrenergic neurotransmitter domination. Adrenergic neurotransmitter domination increases blood volume. There is a poor water cycle and release from the urine. Inability to drink is commonly seen in such people. They will say if they drink more water, they feel full and they feel like nausea after drinking. Also, due to the inflammatory action in the neuroinflammation in the brain, there are glial tumors that form and dizziness is seen and spasm of the arterial walls and microclots are formed. Low nitric oxide leads to sticky platelets. So microclot risk, migraines due to spasm of the arteries, Raynaud's phenomena, and hypoxia of the glial cells, gliosis and neuroinflammation is seen. Homeopathic remedy, belladonna picture. As you will read through a Boric and Clark, you will see that the belladonna picture has every symptom which shows low acetylcholine. Belladonna acts upon the every nerve part of the nervous system, producing active congestion, furious excitement, perverted senses, twitching, convulsions, and pain. It has a marked action on the vascular system, skin, and glands. Belladonna always is associated with hot red skin, flushed face, glaring eyes, throbbing carotids, excited mental state, hyperesthesia of all senses, delirium, restless sleep, convulsion, convulsive movements, dryness of mouth and throat, with aversion to water. Neuralgic pains that come and go suddenly, heat, redness, throbbing pain, burning. Great children's remedy. Epileptic spasm followed by nausea and vomiting. So these are some excerpts from the Boric. Pain worse light, noise, jar, lying down, and in afternoon. Acuteness of all senses, pupil dilated, diplopia, staring, dry, glassy vision, spasm of stomach, empty retching, abhorrence of liquid, spasmodic hiccough, dread of drinking. Feet icy cold, superficial blood vessels distended. Perspiration dry, only on head. No thirst with fever. Worse, touch, jar, noise, draught. Afternoon lying down. Ill humor, disposition, irritable sensitivity. And an inclination to be angry and to give offense. This is written in Clark. Dementia to an extent as no longer to know one's friends, illusion of senses, and frightful vision, complete loss of reason, stupidity, inadvertence, and distraction, inaptitude for thought, and great weakness of memory. Memory quick, weak, lost. That's an excerpt from the Clark. Thank you very much. I hope you will go through it again and again, and you will get to know more about how belladonna is a clear picture of low acetylcholine. So belladonna helps in improving, in the chronic form, belladonna helps in improving the acetylcholine levels. In the acute state, it helps in affecting the thyroid gland. As you can see in the boric, it is written in the exophthalmic goiter as well as thyroid toxemia. So visualizing the pathophysiology of acetylcholine, its physical effects are on the motility of the GI tract, behavioral inhibition and hyperesthesia of sense organs, cognition and learning effects, glandular release affected like sweat and salivary glands, and vasoconstriction and spasm with microclots and mucous membranes appears congested. Thank you very much.